Gabriel Scientific was founded by partners with many years' industry experience. The company was formed to address the growing problem of hospital-acquired infection. And the technology, PNeumoPure technology, consists of a physical barrier to prevent ingress of airborne and waterborne pathogens. As well as providing a barrier to infection, it's important that the PNeumoPure filter allows the product to breathe. If you imagine putting your head on a pillow, that pillow has to squash, it has to drape around the shape of your head. And one of the problems with just creating a sealed, welded product without any breathing is that you get a balloon effect. It's a bit like having your head on a balloon. So the idea of the filter is that it allows the pillow to collapse under the weight of your head. The filter, the PNeumoPure technology, provides its barrier to infection by means of having a microporous membrane. This membrane has tiny holes in it which are so small that it prevents the ingress of small airborne or waterborne microbes. It's also waterproof, so any bodily fluids cannot enter the pillow. All the seams of the pillow are high-frequency welded, and that means that they're also sealed. And one of the reasons that previous attempts to solve this problem have failed is that the seams of the pillow were stitched, and that meant that air or water could still enter the pillow. It's a technology that can be applied across a range of products, not just a pillow, but also duvets, mattresses, seat cushions, because all these products provide a potential vector for infection transferred from one patient to the next. The interior of any of these products in their standard format have been found to be full of numerous pathogens. Numerous studies have been done showing that it's very common for bedding of various types to be infected with pathogens. And the important thing to bear in mind with the PNeumoPure technology is that it achieves this blockage of pathogens by mechanical means rather than by chemical. One of the reasons we worry about blocking pathogens with the use of chemicals is that we're now beginning to learn that organisms like MRSA are gradually developing an increased resistance to those chemicals that we're using to target them. The material of the filter is a unique engineered microporous membrane. That means that it's a material that has tiny holes in it, small enough to prevent pathogens from passing through, but large enough to allow air to flow. The material has been the subject of many years' development by Gabriel Scientific and also the subject of numerous patents.
Sleep Angel products are designed to address the problem of the risk posed by hospital bedding of contracting hospital-acquired infection. In the past, pillows, duvets, mattresses and the like were had sewn seams, and as Dr. Bain has said, those seams could be a source of pathogen ingress, whether it was through absorbing contaminated fluid or airborne pathogens passing through needle perforations on the seam to the interior of the product. The Sleep Angel products, through the PNeumoPure filter, uniquely block those pathogens by being a hermetically sealed product, and the microporous membrane blocking the pathogen ingress but allowing air to flow in and out of the product, and air passage in and out of a cushioning device is essential for shaping and draping to the patient. Currently we have pillows and duvets, Sleep Angel pillows and duvets with the PNeumoPure filter attached. Shortly we will have mattresses and wheelchair cushions, and there's a number of other future applications for the technology in cushioning devices, both in hospitals and of course in the broader sector, hospitality industry, hotels, and eventually we see ourselves producing consumer pillows and duvets for people who want a more healthcare, wellness orientated product in the home. There's a significant risk and cost reduction benefit through the use of Sleep Angel products. In particular, laundry bills are eliminated. the products can be cleaned using standard hospital cleaning protocols. Whoever is doing the cleaning, whether it's housekeeping or the clinical staff, will typically clean down the bed frame, the mattress, and now using the exact same cleaning solutions and protocol, they can clean the pillow and the duvet. And in the future, they'll be able to use the same protocols for our mattress and our wheelchair cushions. Also, the risk of spreading infection around the hospital as you move pillows and duvets around the hospital to laundry and back onto the ward is also eliminated. Sleep Angel products are registered Class 1 medical devices and are CE marked. They are compliant with the relevant standards for use in the NHS and in the home. We have other innovations in the pipeline, and they will address well-founded concerns regarding hygiene, both in the hospital again and in the home, in a unique way, and they will also be patented. In many ways, the discourse has moved on, both in the NHS and amongst the wider public, from bed bugs to flu bugs and superbugs. The Sleep Angel products, through the application of the Pneumapure technology, address those well-founded concerns in a unique and effective way.
Hospital-acquired infections are a considerable concern to the population as a whole and to the staff of the NHS. A large portion of my time is spent performing education, training, and identifying new technologies that may reduce the risk to our patients. Various recent strategies have focused upon hand washing, education of the population, and also advanced cleaning of our wards and facilities. During this period, I identified a potential risk with the bedding that is present in our wards. We know this is a potential risk because there's very little literature which gives evidence of whether this is a risk or it is currently sufficient. During my visits to other institutions and also to various congresses throughout the country in infection control, I became aware of this anti-infective pillow from Gabriel Scientific. The reason for my specific interest in bedding and pillows is because of the relative lack of evidence-based medicine in the literature that is available for us as a reference point. So our role is to establish the relationship between bedding and infection and make appropriate recommendations for the benefit of the patient and the interests of the NHS. A planned solution for some of the problems and difficulties encountered in the NHS, as directed by the Department of Health, is to seek innovation from novel areas that are not traditionally involved in healthcare, to use their experience and expertise and apply it to our concerns. In this aspect, the very novel pillow with sealed seams and a biofilter which allows passage of air in and out but prevents movement of bacteria is, in my mind, a very innovative product, and it has a significant potential to improve the cleanliness and reduce the contamination of any bedding.
The material of the filter is a unique engineered microporous membrane. That means that it's a material that has holes small enough to prevent pathogens from passing through, but large enough to allow air to flow through. This is what gives us the breathable but waterproof and pathogen-proof membrane. The material has been the subject of many years' development by Gabriel Scientific and is the subject of numerous patents.
There's a significant cost benefit to hospitals using the Sleep Angel range of products because laundry bills are eliminated. Also, the risk of contamination or infection being spread around the hospital through the movement of duvets, pillows to laundry is also eliminated.
We aim to be synonymous with preventing infection in hospital. And I think what we have developed with the Pneumapure technology and the Sleep Angel range of products is a uniquely simple way of addressing this problem. Products like mattresses, cushions, duvets, pillows really form the bedrock of a patient's stay in hospital. And it's by addressing these simple things that I think we can do most to reduce the incidence of hospital-acquired infection. And I think the way forward is to adopt these and the new innovations that we will be developing in the future.